Hi, I'm Jerry Dillon, and I'm back here with my good friend, Dr. David Aronoff. So last time we were talking a little bit about coronavirus and where we were at that particular time, and it's been about 2, 3 weeks, I think, since we last talked. So, well, from your viewpoint, David, I mean, where do you think we are with in terms of looking at the data and how the progression of the virus and self-isolation and so forth has gone on?
Yeah. Well, first of all, thanks, Jerry. It's great to be here. And again, to be across continents and being able to communicate like this is really special. And I appreciate the opportunity to get together with you. It's a really both a rapidly evolving global problem and increasingly feels like a very slow moving vehicle for a lot of us because this pandemic doesn't seem to want to disappear quickly. So it's remarkable how fast it's become a global problem. And now we've sort of moved from the shock and awe of having a new infectious disease that's completely disrupting the way that we interact and the way that we live our lives to now thinking, well, how do we create or understand a new normal? And I think this is something, at least in the United States, we're sort of at the point of seeing a lot of tension around the desire to continue to keep people safe and do as much to mitigate the spread of this pandemic to uninfected people with an obvious observation that the economy is suffering a great deal, that people's livelihoods are being just absolutely destroyed by the shutdown of society. And so there's a lot of tension with people who, both in the government and outside the government, want to turn the lights back on, sort of. And so, we're at a situation where a very small fraction of the population has at least been infected in a way that we know through either diagnosis or just estimation. It's a pretty small fraction of the population. So clearly there are a lot of people who are continued at risk. But in some areas, I mean, I'm living in one of those areas, disease activity is pretty flat, and we have about the same number of cases erupting every day. And our hospital system has not been overwhelmed by patients. And so people are understandably getting very itchy about wanting to go back out to public venues. In fact, in a town just south of where I live, yesterday they said you can go back to public restaurants, and they have to be at 50% capacity, and you can go back to health and fitness clubs with some mitigation techniques in place. But this is the kind of thing that we're starting to see now, and I think it's playing out globally, is that there's ongoing fear on the part of public health, but ongoing anxiety on the part of the public in general about getting back to a normal and trying to push through the pandemic.
Yeah, I can definitely kind of get a sense of that. I think some countries they're saying where they got low cases, but just thinking back a few weeks ago, I wouldn't say necessarily complacency, but it's kind of this like let's wait and see approach was occurring, and then suddenly just this big explosion, and it's like holy moly, where do we go from here? So the danger is kind of falling back into that trap, let's say. So out of interest, well, what sort of numbers are you talking about when you said, like where you are? What's the hospitalization rate or number of new cases every day and death rate? I mean, what are we looking at there?
Yeah, so I live in a state called Tennessee that has just under 7 million people in the whole state, about 6.8 million people. We just crossed the 10,000 patient mark in terms of known diagnoses of COVID-19. And of course, we're diagnosing what we might suggest is a bit of a tip of an iceberg, because in Tennessee, we've largely been diagnosing people with symptoms of disease. And we think that there is a population of people that may be pretty large that get infected and either don't have symptoms or their symptoms are so mild that it doesn't even come to their attention that they might have COVID-19, or they don't bother to go get tested. And so that 10,000 is probably a gross underestimation of the total burden of infection, but compared to a population of nearly 7 million, you get the sense that that's a pretty small fraction of the population, even if we're, 4 times underdiagnosing it or something like that. 40,000 or 50,000 people in the state were infected. That's still a pretty small fraction of nearly 7 million. And that's been sort of the case globally. At our hospital right now, we have around 20 to 30 patients in the hospital with COVID-19, and that's pretty low compared to my colleagues in places like New York, where for a long time they were admitting 100 patients a day or more to their hospitals, and that was playing out at multiple hospitals all around the city, and they were clearly overburdened. And cities south of us, like New Orleans and Birmingham, Alabama, have had more activity. In Tennessee, it's been a little bit less. And, I think that of all the people being tested in Tennessee, a little under 10%, maybe 6 or 7% are coming back positive. And I think, I want to say there've been maybe about 700, I probably wrote it down here somewhere, but maybe about 700 or so people in the state have died of the coronavirus. It's between 1 and 200 in the city of Nashville, where I live. Mortality from the people who are diagnosed is still around 2% or so, maybe upwards of 4%. But again, that's out of the people who are symptomatic and coming to get diagnosed. So the true mortality is likely lower than that, but we're not experiencing a great difference than other areas, but lower than Italy, lower than probably New York as well.
Yeah, yeah. I mean, I assume you're probably quite spread out as well, so probably helps with the social distancing and so forth as well. So obviously we're kind of waiting for this vaccine, but I mean, I guess one of the question is, and maybe we're getting an idea, I'm not sure, about the evolution of the virus, because let's say we get the numbers low enough and we have the approaches a bit like you said, because we have these kind of social distancing, but we still have to go to restaurants and opening up services on a gradual basis. We may be living in that state for a little while, I suspect, because I think once we think the numbers are manageable, we kind of fall into that kind of sense of security that we think we know where we're going. But obviously the danger, like I said before, maybe that it might just explode again. So we need to be vigilant, I guess, with that response. So with the evolution of the virus, do you think, first of all, my thought pattern is that there should be some control around monitoring and testing. We should have a better handle on that first of all before we do open up. And then also, is it likely to mutate and maybe, hopefully, I mean, in a ideal state, we might get a lesser extreme response to the virus, in which case we're able to kind of get to that kind of herd immunization level. I mean, what's your thoughts on that? I mean, is that a bit of a loaded question, or?
Well, no, it's a very common question. It's really on a lot of people's mind. I think if the majority of people in a population were to get infected eventually, there would be widespread immunity to the virus. We still don't know what that means exactly. We don't know if immunity is something that will last for a long time. We don't know if immunity means that if you get reinfected, you won't have any symptoms at all, or if it means you will have symptoms, but they will likely not be severe. Sort of like when people get a flu vaccine, you can still get the flu and you can still transmit the flu, but you're likely to have a much less influenza severity if you've been vaccinated, and you may even be asymptomatic if you've been vaccinated. We're still wondering how this is going to play out with coronavirus. When somebody gets this infection, what does that mean for their risk, not only to get sick again, but even to be a vessel for transmission? Does it block that or not? that's a big unanswered question. Right now, if we say that 10% of the population or fewer than that have been infected, then the likelihood that we have any kind of herd immunity as a population is pretty low. We would really need a pretty significant fraction of the population to be infected. But given the fact that, 1 in 5 people who get infected get pretty severely ill, maybe it's a little less than that, 1 in 6 or 1 in 7. And it may be that 1 or 2 or 3 out of 100 will die of the infection. It's hard to want to see a majority of our population get infected with this virus, for sure. So, this is where I think we're all eager to get vaccines going or effective treatments, because if we don't have a vaccine and somebody gets infected and they start to get sick and you can diagnose them quickly and there's an effective intervention, then that's a game changer. So, we'll get there with this virus. We will get effective treatments and we will get effective vaccines. But in the meantime, we're sort of slow rolling this in society, and it's keeping people without income, and it's keeping people locked in, and we're all dealing with it. We're all having to deal with this in the same way, which is, just sort of hunkering down and being very inactive and locked in.
Yeah, I know. It is what it is, isn't it? I mean, I think we have to adapt in those type of circumstances, and it's amazing how much people value a haircut now. Maybe not in your case, but my case is.
I miss having haircuts. Let's say that.
I saw some clips on the social media. It's like people saying, "Oh well, we're going to be hunkering down. I'm safe for the next 10 years." But no, when it actually happens, you're like, "No, I need to go out and get a haircut." Seems to be more important. So quickly, I think you need to. We've only got a few minutes left. I just want to ask you about. There's been talk about some vaccines maybe rolled out a lot quicker, and I realize it's quite a difficult thing to get right, because there could be so many different variations and strains of this as well. So it may work in some cases, but let's just say there is some vaccines that may be out imminently, which will be relatively safe. In your view, how long do you think is it still that 12 to 18-month period, or could it potentially be a little quicker than that?
Yeah, I don't know, because all of these vaccines that are in clinical trials now still need to finish those clinical trials. These are likely, most of them, placebo-controlled trials where some people are getting active vaccine and some people are getting a dummy sort of injection. And we have to see what happens in terms of protection from infection, look at the data very closely, and there may need to be validation studies in other populations. That normally takes quite a long time and can be a matter of many years. And so it's been compressed as much as possible. I don't know exactly where we're at, but it's hard for me to imagine that in the next 12 months we'll be massively deploying a vaccine. It would be great. And I'm sort of waiting a bit with bated breath, as everyone is, for some of the results of early trials. I know that philanthropists like the Bill and Melinda Gates Foundation and other agencies, both governmental and non-governmental, are pushing a lot of resources into these trials to do many at the same time to see if there's some lead candidates. But I haven't seen the light at the end of the tunnel just yet, so I'm not sure how quickly we're going to see a vaccine. But people are working as fast as there's capacity to work to get these things out there, and of course balancing that with safety, because not only do these have to work, but they also have to be safe. And so, there's a lot of attention being paid to that.
Yeah, absolutely. I mean, I can understand. I mean, it's not just the vaccine production, but it's the manufacturing process of getting it out to everyone as well at the same time as well. And I think there's also issues. I mean, we're trying to play catch up with the testing and
Right.
I think the other factor that's been kind of it's getting a little bit of traction is the monitoring. Whereas countries like South Korea have been really, hot on that. I think we need to kind of catch up, to say, well, we can trace where this is going. So if this social distancing is to be a success, then I think we need to have those sort of measures in place as well. And
Mm.
I'm sure there's work being done, throughout the world, I guess, to kind of do that. And as you say, I mean, it's a new way of living and ascertaining. I'm hoping that some people will probably have a little bit of time for reflection, and not to kind of just jump at trying to get back to where they were, which is maybe not the most healthy way to be in the first place, right? I mean, so anyway, I guess we'll leave it there, and we'll pick it up another time. Thank you for
Yeah,
your
we
time.
should do. Oh
Yeah,
my gosh, it's a pleasure to be on here with you. And it may be good also to collect some questions from people who are watching and see if when we meet next and that maybe next week we could do this and sort of try to unravel some of the questions that people have who are taking the time to tune in. But I'm really, really honored to speak with you.
thank you, David.